sa mga Pilipino. Ngayong pandemya ay sama-sama tayo, walang iwanan, isang pamilya tayo. Kami narito maglilingkod sa inyo, dahil handa ang aming puso para sa lahat ng Pilipino. Sama-sama walang iwanan, COVID-19 natin lalabanan. Ating Jesus ang siyang dahilan ng serbisyo at paglilingkod na handog namin sa inyo. Pandemya ay sama-sama tayo, walang iwanan, isang pamilya tayo. Kami narito maglilingkod sa inyo, dahil handa ang aming puso, dahil handa ang aming puso, dahil handa ang aming puso para sa lahat ng Pilipino.
Recording in progress. Recording stopped. Recording in progress.
I'm Dr. Joy Mercado, BMS President 2020-2021. This song, written by Dr. G. Blando, is our humble contribution to the Philippine Medical Association, headed by Dr. Benny Atienza. We hope that this song will give inspiration to our fellow doctors amidst the current pandemic that we are in.
I am Dr. Chi Atienza Blando. I am a past president of the Batangas Medical Society. I was requested by Dr. Joy, our outgoing president and a fellow pediatrician, to write a song as a tribute to PMA as it faces this COVID crisis. It took me no time to finish the lyrics of the song, which I call PMA One and Proud. Like my colleagues, I am a proud Batangueño member of the Philippine Medical Association. And I want to be loud about our passion to serve the state with love, compassion, and faith, and to heal our land together as one. Mula po sa amin din sa Batangas, ang aming handog, PMA, One, and Proud.
We stand tall, we stand strong, PMA is where we belong. We stand together, we are one. One band, one voice, one song. Driven by love, compassion, and faith. We serve our people, we serve our state. We heed God's call to heal and restore. Weakened hearts, bodies torn and soul. We are one, we stand proud. Come on, come on, be loud. We are one PMA. Together we are one. We hear your call and together we will come. To PMA we offer our strength. For PMA we give our hearts. We're one PMA, we're proud PMA. Healers, doctors, we work together as one. We are one, we stand proud. Come on, be loud. We are one PMA. Together we are one. We hear your call and together we will come. We are one, we stand proud. Come on, be loud. We are one PMA. Together we are one. We hear your call and together we will come. We are one, we stand proud. Come on, be loud. We are one PMA. Together we are one. We hear your call and together we will come. We are one PMA. We are proud PMA. Be loved and proud.
Good day, this is Dr. Benny Atienza, the PA President. At this point, I would like to thank Dr. Joy Mercado of the Batangas Medical Society with Dr. Nilo Arducoresa of the Batangas Medical Society and Dr. Regina Chiblando who wrote the lyrics of this song. As the message of this song goes, that we doctors should be working together as one and be united. Let us beat this pandemic.
dito sa aming bayan, sa Katagalugan, na kung tawagin ay lungsod ng Batangan. Marami ang mga nabuong samahan, lahat ng hangad ay pagtulong sa bayan.
Kami man mga manggagawa, may samahang tulong ay laang iabot, taon sa puso at walang halong pag-iimbot. Sa palala, dunong at talino ay handang idulot. Batangas Medical Society, samahang iginagalang ng marami. Mga Batanggenyo, iba pang mga lahi, ibinabandila, itinataguyod na may pagmamalaki. Batangas Medical Society, dito sa Batangas City, mga manggagamot ang kumakandili. Kalusugan ng lahat ang hinahangad lagi, para sa tunay na kaligayahang minimithi.
Halina mga kasapi ng samahang tinatangi, pagkalinga sa lahat ay ibahagi.
Recording stopped.
Good evening po, Dr. Ting. Okay na po.
Okay, good evening everyone. Good evening doctors, nurses, and to all the different staffs of the different hospitals here in Batangas City. We are really fortunate to be gathered here today for this very special event and very special scientific lecture. 4 or 5 days ago, prior to this event, me and our esteemed speaker met by chance at one of our hospitals. Ang sabi ko sa kanya, Doktora, paano na ba tayo? Sabi ni Doktora sa akin,
Recording in progress.
Delta is at our doorstep. Pero up to today, I think, Doktora, Delta has already entered our zone. So alam natin kung gaano kabilis si Delta, kaya ganon din kabilis si Dr. Javier at ang BMS na nagdalas-dalas upang maisagawa ang pagpupulong na ito. So I know everyone is excited to hear this lecture. So let us start now with in our program, let's have our BMS prayer, BMS hymn, and our national anthem.
We praise and thank you for the gift of life and the grace that you bestowed upon us, Lord. Let us heed and follow you through service and love. Guide Batangas Medical Society. Strengthen its leaders and members to learn and to know what is good, Lord, to grow in faith and kindness for others with warmth. Lead Batangas Medical Society. To be a family that works together, a family that embraces peace and hope. To be a family dedicated forever, holding each other, healing the world as one. As physicians, we are your instruments of life. To serve with skills and talents you endowed us, Lord.
Kayang magiliw, pero sa silanganan, alam ng puso, sa dibdib mo'y buhay. Lumang inilang, tuyang ka ng pag-ibig, sa manlulupig, di ka kasisinig, sa dagat at bundok, sa siwoy at sa langit mo pakaw, may dinatang tula at awit sa patlayang minamahal. Ang isang lawatan mo'y ganun ay narating, ang bituin at karamyang kailan ka may di magdidinig. Walang araw ng walang ibang sila, buhay langit sa piling mo. Aming ligaya ng pagmay ng langit, namamalay lang dahil sa'yo. Puso ko'y tinig ng kasayahan, dahil ako'y nasama sa tanan. Ang lahat may gintong nasa, makisig at masigla. Kapisanan ay tunay ang damdamin, suliranin itong baya'y pawiin. Idalangin natin ang tapat sa may kapal, ay lunas sa lahat. Awit ng DNA, tayo ay mag-iwan. Magtulungan, magunlad ng bayan. Ang kailangan, ibigay sa kanan, kalusugan at kasaganaan. Ang puso ko'y tigib ng kasayahan, dahil ako'y nasama sa tanan. Ang lahat may gintong nasa, makisig at masigla. Kapisanan ay tunay ang damdamin, suliranin itong baya'y pawiin. Idalangin natin ang tapat sa may kapal, may lunas sa lahat. Idalangin natin ang tapat sa may kapal, may lunas sa
Okay. Good evening once again. May I call now our dear President of the Batangas Medical Society 2021-2022, Dr. Corazon Lanuza, for her welcome remarks.
Okay. Good evening, everyone. Sorry. Hindi kasi ako i-allow i-unmute kanina. I'm sorry. Okay. Good evening again. I would like to welcome everyone all of you, not only the doctors, but all who are in the medical and health professions. Thank you for joining us tonight in this very special lecture. This is a very timely topic, and I know it will be of help not only to the doctors, but to all of us. I would like to thank our very energetic, knowledgeable, approachable infectious specialist, Dr. Jade Javier, for finding time and sharing her time, her expertise, and knowledge to us all. The Batangas Medical Society is very happy and we are very willing to serve everyone, not only in the medical professions, but all of us, everyone who has one goal, that is to save lives. Everyone, please stay, relax, and listen to this very fruitful, helpful, and very important topic. So stay safe, everyone, and God bless us all.
Okay, thank you very much, Dr. Lanuza. So without further ado, here is one of our favorite lecturer in our RTDs and the winner of the recent PMA Dr. Hermogenes Santos Memorial Award for Continuing Medical Education. Let us all welcome Dr. Florence Amorado Santos to introduce our esteemed speaker.
Thank you, Dr. Rating. Good evening, everyone. We're very excited and very happy that all of you can join us tonight. I can see around 471 participants. Okay, so our speaker, okay, for tonight, it's actually needs no further introduction. Okay, but I will not dwell, okay, on the academic achievements that she had gotten during her pre-med and medical school years, mainly because he was able to get all the highest awards, okay, during this academic years. I will not also dwell on telling how she rated during her specialty board exams, because you name it, first or top notcher or second to the highest, she's there. Okay, but I would like to introduce Jade. Okay, as the person who is really the busiest person when this pandemic actually started. Before this pandemic started, she's actually a member of the committee for the medical practice and ethics, the Philippine Society for Microbiology and Infectious Diseases. She's also the chair, Regional Adverse Event Following Immunization Committee for Region 4A. And when this pandemic started, she was thrown into oblivion, and she was actually heading the COVID task force for Batangas Medical Center, which we know is the COVID center here in the region. So she oriented us on how to don, how to doff, and all the ABCs, okay, for this COVID pandemic. She chairs, okay, the Infection Prevention and Control Committee of the Batangas Medical Center and the other hospitals in Batangas City. And she diligently and patiently formulated all, all the guidelines, okay, from scratch, all the guidelines on how we're going to cope up, okay, with this COVID pandemic. And she also chairs the Antimicrobial Stewardship Committee. So siya po yung pinaka pulis natin, okay, sa antibiotics. Lagi po niya ako napupulis. So she's the chair of the Antimicrobial Stewardship Committee of the Batangas Medical Center and the other hospitals in Batangas City. So without further ado, let's all welcome Dr. Jade Javier.
Hello po. Good afternoon, good evening. Thank you, Dr. Lawrence, for that introduction. Personal na yung introduction. Salamat po. Okay. Parang medyo awkward, ano? Parang kausap ko lang yung sarili ko. Okay. Sige. Unang-muna po sa lahat, before po ako mag-start ng lecture, can everybody hear me po? Kahit konting reaction lang. Yes po. Yan. Thank you po. Thank you. Okay. Ito pong activity na to was thought of because of nung pumutok yung nagkaroon ng announcement ang DOH, ang Philippine Genome Center, na meron ng Delta sa Batangas. At that time, we didn't know yet where that index case was. Pero I felt an agitation that it's already here in our place. So nung pong time na yon, siguro may mga kachat ako nandito sa group na to. Tapos kuha ko kagad ng laptop. Sabi ko, kasi I could imagine na iisa-isihin ko yung mga hospitals. Oh, ganito, ganyan. Tapos remind. So I thought of an activity to include everybody. And I would like to thank the Batangas Medical Society, Dr. Lanuza, for welcoming this activity kahit po bigla-biglaan. And I would like, as early as now, baka po kasi makalimutan ko later on, salamat po sa lahat po ng nagpunta. Parang debut ko, Doc? Salamat po sa lahat ng nagpunta, sa lahat po ng mga medical directors ng mga hospitals, including our colleagues in Bawan, in San Pascual. Thank you very much po, and I hope to make your time fruitful. I hope to not waste your time so I can share whatever is in my mind and is in my heart. And at this point, I'd like to tell you that this is an informal lecture. Please do not expect such a highfalutin webinar with all the graphs and all the etc. No? Yung mga malalalim ho, we are a mixed group. So we are a group of doctors and other allied medical professionals. So I'd like to, I would want to be clear to everybody, and I'd like to simplify the principles that we should all know, because we are one family in Batangas. Kailangan magtutulungan po tayo. All right. So now that I've thanked everybody, I would like to share my screen now. Okay. Right. Ma'am Elva, alalayan mo ko, yung marunong masyado.
Yes, doktora. Okay na, nakikita na po.
O, sige, sabihin mo. Alam mo naman, ang tita.
Okay na po, okay na, doktora.
Okay, sige. All right, so you all know the topic for tonight, revisiting our COVID-19 defenses and how do we prepare for the Delta variant. Revisiting, meaning, kagaya po ng sabi ni Dr. Santos, tayo po ay sabay-sabay nagsimula. We all know this. Marunong na tayo, donning, doffing, ano yung mga infection control, infection prevention measures, etc. But it's about time to revisit these practices that we know, because alam niyo naman po, pag nasasanay, no, there's always a tendency to be complacent and to feel that, alam ko na yan, or minsan nakakalimot na tayo kasi it has become so routine and so familiar. So I would like to be the one to remind everybody what we should be practicing in our everyday. So yun po, I'd like this to be a very practical lecture for everyone. Okay, so I'll move on. Okay, the objectives for tonight would be first to know the potential impact of the Delta variant of SARS-CoV-2 in our society. Dito sa Batangas, dito sa buong Pilipinas, at sa buong mundo. Second would be to revisit our present practices, as I've told you, and how to improve them. And related to that will be the third, to discuss possible strategies on how we can strengthen our defenses against SARS-CoV-2. I say discuss because I hope that we will still have a little time, a little lang, huwag naman hanggang 10 ha, pero a little time to more or less share our inputs. And hopefully that this may be a short town hall afterwards. Okay. Right. So una muna, what are the variants of concern? Variants of concern, actually may tatlo yan. So pero ito yung mga variants na sikat, no, na nakita natin. Simplified lang. So meron siyang scientific name, meron siyang WHO name, and then where it was first detected and when. So yung pinakauna, B117 or the Alpha variant, it was first detected in UK. I remember when I was giving a lecture in the post-grad last February, UK pa lang nun. So UK pa lang yung dinidiscuss natin. And then ayan na, nanganak na, dumami na yung mga variants. So the first is the Alpha variant or UK. Second will be the South African variant, B1351. Third will be P1, which is Brazil. And itong ating pinaka-concern will be the India or the Delta variant, which is B16172. Okay, the three variants of concern, UK, South Africa, India. Okay, so wala pong exam, huwag nyo na kong i-memorize. Pero ang focus natin ngayon is the Delta variant. Okay, so why are there variants in the first place? Nagkakaroon po ng variant ang mga viruses because of mutations. So alam naman natin, lahat tayo nasa healthcare field. So we've gone through this at one point or another. Mutations are natural occurrences in viral replication. And come to think of it, even nga in human, pag ba nag-replicate ang isang tao, kamukhang-kamukha ba niya exactly yung magiging anak niya? Of course not. There will be differences. And sa virus naman, this is because of yung mga mutations. It can be insertion, deletion, substitution. But ang point is, there are some errors in the viral replication. This is natural. It happens. No? Most of these errors or mutations are benign. Parang hindi na napapansin. It doesn't matter. It doesn't affect the behavior of these viruses. But there are certain mutations that when it induces change in the virus, it renders the virus more notorious, more infectious, more resistant to infections. And these are the viruses that become dominant kasi lumalakas sila eh. So, yung mga variants na ito, the variants that I've previously mentioned, these are the ones that with mutations that have rendered them more fit for survival. Okay, so that's the reason why we have variants. Natural po yun. Now, why is the Delta variant more transmissible? Bakit po siyang ang daling makahawa, biglang lobo ng mga cases? So this, I'd like to show you, this is a graphic representation of the spike protein of the virus. Can everybody see my cursor? I'll assume you see my cursor. No? So this is the spike protein of the coronavirus, and this is the ACE2 receptor in the body, most commonly in the lung. So this is where they join. So doon po sila nag-a-attach. And as you see, the spike protein of the virus, of the coronavirus, is the one that is very prone to mutation. So these mutations, 4 mutations, are the most prominent, most prominently studied, but there can be more. Pero ito pong mga mutations na ito, this is what causes the Delta variant to be more transmissible. So kapag nagkaroon ng mutation, what are its effects? So the effects of the mutations in the Delta variant, I'm specifically saying Delta variant, is that number 1, it can lead to stronger binding and interaction between the virus and the host. What does that mean? Stronger binding and interaction. Example, this is your ACE2 inhibitor or whatever receptor in your body. This is the virus, right? So, kapag kumapit siya or naka-attach siya, there might still be a chance, no? Kumalas siya, no? Probably in the original virus. But here, in the Delta variant, once it attaches, there's stronger binding and interaction already with the virus, between the virus and the host, that leads to lower chances na hindi siya mag-enter into the host cells. So because of this stronger binding, there's faster and easier entry into host cells. Nakakabit na siya, pasok na siya kaagad. It's like a burglar having a key, no, to a house. Rather than magtatanggal-tanggal pa siya ng door, gagamit pa siya ng mga gamit. No, the thief has a key and it can enter the house immediately. So this is one dreaded effect of those mutations. One quite interesting, probably a little scary part will be there's data that there is less effect of neutralizing antibodies in post-vaccination sera. So when you say neutralizing antibodies, these are the antibodies that actually negate the action of the virus. Kasi marami pong antibodies eh. Some antibodies, kung hindi siya neutralizing, wala lang siya. Antibody lang siya, pero it doesn't give you defenses. So, if there's less effect of neutralizing antibodies, then this may affect our defenses even if we are vaccinated. And now there's some data also, although this is not, according to the literature that I've read, hindi pa siya talaga proven, but there are some anecdotal data already from different countries that it may survive longer in the air for longer than 12 hours. So it makes you think, yun bang sa contact tracing natin, yung bang 15 minutes, no? 15 minutes na dapat kausap mo or ka-contact mo, is that still applicable? The answer is I don't know. We don't have data yet right now. Probably pwede pa rin, no? Kasi coronavirus pa rin naman yan. However, we should be more cautious because if it really can survive longer in the air, even fleeting encounters can lead to infection. All right. That has a significant implication in one of my slides later on. Okay. So how transmissible is Delta? I'm very proud of this slide kasi ginawa ko siya. Hindi ako magaling gumawa ng mga slides, pero here, pinangtong-patungan ko siya ng picture. Diba? So this is the first strain of the SARS-CoV-2. When the UK variant came, it is the Alpha variant, they saw that the Alpha variant is 50% more transmissible than the original strain. But when the Delta variant came along, it is even more transmissible, 50% more transmissible than the Alpha variant. So that's parang exponential siya. So it became fitter and smarter. All right. Let's do a little basics muna. No? So reproduction number. No? In infectious diseases, pag meron kang pathogen, there's a certain reproduction number, meaning it is the number of individuals that one index patient can infect at a certain given time. So for example, the original virus ng SARS-CoV-2, the original reproduction number niya on average is around 2.4 to 2.6, meaning it can infect around 2 people. So one index case can infect 2 people. When the Alpha variant came, the reproduction number ballooned. So one patient can infect around 4 to 5 people. However, the Delta variant is even more alarming, if I may say. The Delta in one index patient of a Delta variant patient, one index patient na may Delta variant can infect around 5 to 8 individuals. So just imagine the typical Filipino household. May isang Delta, kunwari galing sa random place, Cavite, random. Dala niya yung Delta, meron siyang 2 magulang, isang asawa, 3 anak nasa isang bahay. Just imagine that one Delta variant case can infect the entire household. And this is one of the reasons why, if there is usually clustering in an area, this is already an indication for genome sequencing. All right. So as compared to other viruses, mumps can infect 12, measles can infect 18, but basically measles and dami because this is airborne. Okay, so definitely, siguro nakita nyo na rin to and napanood sa social media, Delta variant has been named the fittest and the fastest SARS-CoV-2 so far. Okay. It is now the fittest and the fastest. And I'd like to emphasize again and again, it is here already, so we should watch out. Here, this is a study. I'd like to insert some articles on this, so please don't get bored on me. Probably for those members in the BMS group, probably you're familiar with this. I think Dr. Florence posted this article. Napaka-timely, so nakita nyo na siya. Pero I'd like to emphasize what this actually means. No? This is a preprint, meaning hindi pa siya talaga official na paper. But here, if you'd like to visit this website, marami po dong mga preprints ng mga data. Quite interesting, no? And very informative site. This is a paper on viral infection and transmission in a large, well-traced outbreak caused by the Delta variant. This is in China. So they investigated 167 infections and they found that all 167 can be traced back to a first index case. And what's very important here is that they found when they quarantined these people, what they did was they did RT-PCR daily, no, RT-PCR on those until they became positive. And they found that the viral loads of Delta infections when they first became positive for PCR were on average 1,000 times greater compared to the other strain. Again, I'll repeat that. Viral loads of Delta infections were on average 1,000 times greater compared to the usual strain. What does that actually mean? What does that imply? So that means the virus is capable of faster replication. Pagkapasok niya sa isang host, ang bilis dumami. Faster replication. And because there's faster replication, the viral loads increase significantly compared to the usual strain. And if viral loads are high, this will lead to greater infectiousness. Syempre, marami siyang virus eh. So marami siyang pwedeng share. And because viral loads are very high, they also become infectious. All right. Hello? Can you hear me?
Yes, Doc. Naririnig ko po kayo, Doc.
Okay. So they become, there is greater infectiousness and they become infectious sooner. And because they are infectious sooner, sometimes even in the pre-symptomatic or in the asymptomatic phase, they lead to faster transmission of infection. So ito po yung important na kailangan nating maalala palagi regarding the Delta virus. It is scary. No? However, it doesn't mean that we cannot combat this infection. We can prevent it. We can fight it. And this is what this lecture is all about. Okay, so what can we do to prevent the surge? Oh, meron na tayo kaagad clue. Ano? What can we do to prevent the surge? The first reminder, take the following precautions seriously. Okay? Kasi lagi tayong paulit-ulit. We have all these policies, we have all these guidelines, but do we really take them seriously? Do we really put them to heart? Are we thinking about ourselves lang or even our families and co-workers? So this is my first very important reminder. Take the advice seriously. Okay. Wear your mask properly. Here I'll be in the next few slides, it'll be very simple. More on pictures lang. Pero I'd like to emphasize this because ito po yung scenario natin eh. I can present highfalutin data, all the journals and whatnot, no? But not everybody can relate. Meron po akong ibang mga ipe-present na mga observations, no, sa ating mga hospitals that I think we can improve very well. So, wear your mask properly. So, syempre, hindi labas yung baba. Not showing your chin. Of course, definitely not showing your nose. Covering the entire lower part of your face, your nose, your mouth, and chin. Please. And it's not just about wearing your mask. It's about teaching others to wear their mask properly. Remember, it's your protection also comes from the other person. So kung makita mo, nakamask ka pero yung kabila, hindi, sawayin natin ng konti. Sir, pakitaas naman ho ng mask ninyo. Do not be shy because you are protecting the rest. Alright, so that's my first simple reminder. Wear your mask properly. This is for the surgical mask. What about the N95 mask? So ito po yung may mga mask na ganun. Alam ko ayaw to ni Dr. Florence eh. Gusto niya yung ear loop, ganyan. So yung dito, yan. Okay, so these are just, I think I got this from WHO ba or CDC. I forgot where I stole this from. But first, the correct way of wearing your N95, hold it on your hand, naka-cup na ganyan din, put on your face. The first will be put the bands above the ear and below the ear. No, I invoke the infection prevention control committees of each hospital, if you can, or I think you should, reorient the proper wearing of masks, all our nurses and hopefully all our doctors too. So one above the ear, one below the ear. Ganun po siya, right? Make sure that you make use of the nose clip here. So dito po, make sure na fit po siya sa inyo. And after wearing it, putting the nose clip there, fitting it very well on your nose, try to inhale. If you feel a vacuum na parang nahigop mo yung mask, that's the right fit. Okay? Yun po yung tama. Pero kung wala, there must be air leaks around. And that mask is not for you. And again, the best scenario, of course, is fit testing. No? I know the limitations of our hospitals, but at this point, sabihin ko lang po, fit testing is very welcome right now that the Delta is here. So if we can have it for our employees and for ourselves, please sa mga admin po, sa ating mga nasa office, kung pwede po tayo magpa-fit test sa hospitals, please. Right? So, yon. And kung halimbawa naman, kunwari naka-face shield ka, make sure that your face shield doesn't get in the way. If it gets in the way of your mask, change it. Okay? Because it's not actually protecting you. It's just bothering you. All right? So that's for the N95. That's the proper way. So put it cup on your face, here up, here, dito sa ng head mo, dito sa pinakatuktok, above the ear and below the ear. Not all under the ear. I know we're trying to protect our mga hairdo, pero I'd rather have a safe mask than a good hair day. All right. Next, what are the don'ts? So, syempre, do not wear a soiled N95 mask. Me, personally, I reuse my N95. Especially ngayon, lalo nang dati, at saka pag hindi summer, so hindi masyado kang sweaty. Usually, I'm able to reuse my N95 for several days. No? Siguro mga 2 to 3 days. And sometimes, meron kang pang sterilize again. No? So that will add another day to the life of your mask. But, if your mask is really soiled, pinawisan ka na ng sobra, naubuhan mo na siya ng madami, please dispose of it. Because hindi lang naman virus ang problem. Baka mamaya bacterial infection nandiyan na. So minsan kaya tayo nagkakamaskne, etc. So if your masks are soiled, throw it. Throw it. The next don't will be if something gets in the way of your N95 or even your surgical mask. Example, the beard. So ito, yan yung sa example in the picture. If there's any facial hair, if there's any jewelry, or any part of clothing that puts your mask away from your face and bothers the fit, avoid it. One thing that I'd like to point out here is, I know baka mabash ako dito, but yung paglalagay ng surgical mask and then N95 on top, surgical mask and N95. If your mask is your really fitted mask sa'yo, yung na-fit test mo, hindi po advisable na maglagay ng surgical mask and then N95, right? But of course, I understand, minsan hindi talaga fit na fit sa'yo yung mask eh. Like yung masyadong malaki, and I understand yung comfort mo na naka-surgical mask. But I have to put it out there, hindi po recommended na may surgical mask tapos naka N95. Alright. Next, do not crisscross the straps. Hindi ko alam kung may nakita na akong ganito. Siguro 1 or 2, na yung pang-taas nasa ilalim, yung pang-ilalim nasa taas. I would understand this, you know why? Because sometimes, most of our masks are not well-fitted. Malalaki po siya. No? Like for me, ako yun sa green, 1860S ako. Pero marami kasi 1860 yung ginagamit. So I would understand, baka kaya nila pinapahigpit. But actually, this is not recommended because pwede pong mas mahirap din siyang i-doff. Remember that doffing is very important. Actually, mas nakakatakot po siya kaysa sa donning. So you should be able to remove your PPE without any hindrance kasi yun na po yung madumi. Right? Okay. Ito, the fourth one, do not wear a respirator that does not have a proper seal. I've mentioned this already. Fit testing is the key here, right? And if you are to remove the mask, please do not touch the front portion. So, I'm wearing a mask right now. So like this, oh. So So, ganyan. When you remove this, yan lang. Hindi mo na gagalawin yung front. Do not touch this one. Alright? Lalo na kung galing ka po sa hospital. Alright. So, that's just for the mask. Okay. Next, wash your hands. Ito, ang dami nating, pasensya na po kayo if nasisimplihan, you're thinking, simple naman itong slides ni Jade. These are all important. And kaya ko po ito nilalagay dito because I know that we have nurses in the audience. To all our nurses, shout out sa inyong mga kaibigang nurses. Marami po tayong kailangan pang improve. Many times we forget this. And there is a proper technique in washing your hands. The 7 technique. 1, 2, 3, 4, 5, 6, 7. I'll show you quickly. So, first one, right? One is palm to palm. Simple lang po to. Ito yung tinuturo ko rin sa IPCC. Palm to palm. Tapos step 2, di ba? Sorry po Ano ba mag-asawa, di ba? So magkapatong, right? 2, okay. Tapos, step 3, di nakaganyan. Okay, step 3. Step 4, ganito. On the other side, step 4. Step 5, the 5th, no? 5, your thumb. Step 5. And then step 6, 5 plus 1. Step 6. Step 6. And then step 7. Madali lang po yun. 1, 2, 3, 4. Step 5. Step 6, 5 plus 1, 6, and then 7. We can all have this practice, pero usually, kapag ito po talaga yung topic ko sa isang lecture, nagpa-practice po kami. I give them a test. Step 5, step 3. Yan. Kasi madali naman po siyang ma-memorize. Please do it. Please do it. It can either be an alcohol-based hand drop that's readily available naman sa lahat ng hospitals. Very generous sa alcohol lahat. But ako, personally, I prefer soap and water. So please, wag po nating katamaran. Okay nang sumobra kesa po tayo ay magkulang. Okay? So wash your hands. Next, ito na. Don't linger in the corridors without proper PPE. Ito na naman. Pasensya na po kayo Sariling sikap ko po ito. Mga clip art po yan. So, just imagine this is the corridor of a non-COVID ward. My gosh, walang mask, walang face shield si Ate at saka si Koya. Of course, nobody does this. Nobody does this anymore. But, I'd like to point out some certain scenarios wherein kita mo, parang hindi na to pwede ngayon. Dating ginagawa nila, pero hindi na pwede ngayon. Example, I'm sure some of the nurses here, probably some doctors also, will be able to relate. For example, you're in the COVID ward. And then, syempre, may mga kwarto-kwarto, di ba? And sometimes, nakaano ka na, usual, meron ka namang mask, meron ka ring face shield, pero may titingnan ka lang, magdadala ka lang ng pagkain dun sa door. Lalabas na ako, tatakbo ko, dadalhin ko door. Minsan sisilip ka pa kasi may window. May window dun sa door, sisilip ka pa. Ano ang ginagawa ni sir? Kunwari, nagdedesat. So, pakilagay ho ng mask. Ganon. I know nakaka-relate yung iba dito. Hindi na po pwede yun ngayon. That shouldn't be the case right now. If you are to go in the corridors, make sure that you have the proper PPE. For the nurses, if you don't have any physical encounter, for example, you're just going to the corridor, you're not going inside, at least wear a gown. Level 3 PPE, at least wear a gown. Do not go there na bare yung damit mo. Alright? Another thing I'd like to point out here, for example, ito sa mga doctors, you have a patient, hindi naman COVID to, negative naman pupunta na lang ako, naka-gown na lang. Okay? So, naka-gown, pero nasa COVID ward pa rin, di pa na-trans out. Minsan naka-gown, occasionally magka-cap, pero pwedeng hindi na kasi negative swab na Diba? Remember, the virus can stay longer in the air. No? So, please, the corridors themselves, pwedeng nandun na siya. So, kung pwede po, wear proper, complete PPE if you are especially in the COVID ward. Hindi po porque feeling nyo na, kilala ko naman yan, negative yan. Negative yan. Tapos, you're brave enough to go there, remember, you're wearing your PPE not just for yourself. We are wearing it as part of policy. That's the basic reason. But it's not only about protecting ourselves. What if meron tayong contamination in our body, then we go out? Then we might be bringing that sa labas. We might have been protected sa sarili natin, but what about the others who are exposed to us? So right now that the Delta is here, I think there's no harm in an overstep. We have to do it. We have to protect each other. So if you are especially seeing patients in the COVID wards, please wear the proper PPE. Complete po sana. Kahit pa isipin niya na, ay, negative naman, negative na siya. Yung ita-trans out na lang. Naku, please po, paki-wear po ng complete na PPE. Right? Kasi, you don't know, baka may nagbukas ng door dyan and hindi mo alam kung ano yung lumabas dun sa court na yun. Alright. Never remove your mask when with workmates. And yes, this includes eating together. Hanggang ngayon, meron pa rin po akong nakikita. You eat together. Eh, doktora, nakamask naman lahat eh. Ako lang yung kumakain. No, kahit pa. If you go look into the algorithm, dun sa moderate risk, low risk, moderate risk, and high risk, that still falls into the moderate risk. One person without a mask, having a contact with one person with a mask, moderate risk pa rin yun. So please, if you are to eat, mag-isa na lang po muna. Huwag po kayong magsabay-sabay. Kahit pa sabihin mo na, social distancing naman, Doc. No. I would recommend against it. Okay? Kasi hindi po natin alam ngayon, yung 15 minutes, yung distance, we don't know until we have further data. So if you want to protect yourself and the family that you are to go home to, never remove your mask when you're with workmates. If you are to remove your mask, please po, kabilang room or malayo talaga. Do not eat together. That takes too much time. Okay. Next, ito na. Close the doors, open a window. One thing that would be very ideal would be to have negative pressure rooms. I know there's a hospital na merong negative pressure. Swerte po yung hospital na yon, but not everybody has it. So what maneuver can we do? What strategy can we do to address this? Kasi we have to improve the ventilation. So ganito po. Once you enter a room, lalo na sa COVID ward, close the door ka agad. Huwag nyo na po, mabilis lang naman ako, hindi ko nasasaraduhan, lalawas din naman ako agad. No, please do close the doors immediately para hindi po sila lumabas sa corridors. Okay? So whatever air is in the COVID room, it doesn't leak out much to the hallways. All right? And it would be ideal if you can also open a window in every room. So, madali naman pakiusapan yan. And usually, as I notice it, most of our COVID patients, parang may bantay, right? And I think yung bantay, they would appreciate it if you would remind them na paki-open na lang ang window para hindi po kayo masyadong kulog dito. Para po may hangin na nagsusirculate. They would appreciate it, believe me. So again, as a reminder, please do not forget, close the doors immediately. Ulitin ko po when you enter a room, close the doors immediately. And when a patient is newly admitted, so sa mga kaibigang nurses sa COVID ward, advise, open a window. Hindi lamang kapag papasok kayo. It's better if it's talagang perennially open. Kasi baka mamaya hindi pa naka-circulate yung air, tapos mamaya mag-rounds na kayo ulit. Diba? So it's better na kahit may konting siwang so that there's better ventilation. Okay. Next, ito isa pa na napapansin ko sa mga hospitals. Minsan yung housekeeping, hindi sila masyadong alert sa kanilang PPE. So it's our responsibility to guide them and to remind them. The housekeeping should wear at least level 3 PPE when cleaning the doffing area. Minsan kasi, nandito kaya si Doc Orly, na pag-usapan namin yan. Minsan yung yung basta na lang kukunin, minsan wala pang gloves, yung face shield nakaganon, yung gano'n, di ba ganyan, tapos nakaganon. So, that shouldn't happen anymore. That shouldn't happen anymore. So again, I would like to ask the help of every Infection Prevention and Control Committee to please remind our housekeeping. Malaki po ang role nila. They are very important and we should protect them. So ano ba yung level 3 PPE? So at least a mask, a gown, and gloves. Okay? At least a mask, a gown, and gloves. And because we're in the Philippines, merong face shield. Kung wala namang face shield, basta may eye protection. So goggles. But I think it's easier for face shield, no? Baka easier and cheaper also. So I would advise that a face shield, a mask, at least man lang surgical mask. Pero if you can provide KN or N95, I would prefer that. Okay? Kasi since wala namang patient encounter, pero yun nga, hindi natin alam yung transmissibility ng Delta eh. So if you can provide them with at least a well-fitted, emphasis on well-fitted KN95, that will be better. Provide them gowns and gloves, of course. Please, pakisita ho ng mga makikita ninyong hindi susunod. Pakisita. No, ayoko na sabihin reprimand, ang strict naman ni doktora, pero hindi lang po sila kasi yung pinoprotektahan ninyo. You're also protecting the entire hospital and the families of those individuals. So I think kailangan maging strict na talaga. Sasabihin natin, provided naman di nila sinusuot then there must be a gap somewhere. They probably aren't oriented well or hindi nga sila nasisita. Nakakalusot naman Tinatamad kasi ako, nakakalusot naman So now, it's our responsibility as doctors and nurses na hindi makalusot yung ganun. Alright? So again, this is for the housekeeping. So we have reminders already for the nurses, for the doctors, even the housekeeping, kasama po yan. And what strategies can we do sa mga rooms? Okay. Ano pa nga ba yung sinulat ko dito? Okay, the proper doffing. So doff your PPE properly. So ano ba yung correct sequence ng doffing? Yung donning, hindi ko na po yun probably marami na po tayong experts sa donning. Minsan nga papasok pa lang sa hospital, naka-don na So hindi ko na po yan i-discuss. But the proper doffing is important. The first thing to take off will be the most dirty. Or the dirtiest. Ano bang tama sa grammar? But anyway, the dirtiest part. And the dirtiest part are your gloves. So yun yung unang-una mong tatanggalin. After removing it, some videos and some advice would say, put on clean gloves. But if you don't want clean gloves, and si Mother Earth kasi umiiyak na rin because of the trash, just do hand hygiene. After the hand hygiene, remove your gown. Okay? And at this point, if you have the coverall, you can remove your coverall. Then then hand hygiene again, remove your eye protection, hand hygiene again, and then remove your mask. Most of the times you have double masks, no? Like ako, personally, I have an N95 daily, and then pagpapasok po ako ng kwarto, COVID, naka-surgical mask po ako. So that's the last thing that I remove, my mask. Okay? So tapon. At every step of doffing, please do hand hygiene. Ask for alcohol. Ma'am, wala ng alcohol sa doffing. Or, ma'am, walang tubig sa doffing. Ganon. So please, practice your right na manghingi ho ng mga kailangan ninyo for doffing. Okay? So again, start from the dirtiest, your gloves, hand hygiene, your gown, hand hygiene, your eye protection, or probably your face shield, hand hygiene, and then your mask. And then last, hand hygiene ulit. Okay? You can take a picture or you can ask me. Basta ang gusto ko lang po is malaman po ninyo yung principle ng tamang doffing. Please. Okay? Alright. Yun. So this is just another representation of how we doff properly. If we are wearing the isolation gown, make sure that you remove it and then the outside, yung pong malabas, yung contaminated, inside na po yun ngayon. No? So, sa loob nyo po ilalagay. Fold it and then roll it. tapos tapon. So it's neatly kept away. All right, so again, gloves, the gown, the eye protection, and the mask. Wash your hands in every step. Okay, so doff your PPE properly. Ayan, ito, ang daling sabihin, easier said than done. Clean the air. I don't know, maybe sobrang praning lang po talaga ako, but I think we have to improve the ventilation in all our hospitals. Add negative pressure. Should we provide air purifiers in the wards? I think this is a good idea, air purifiers in the wards, not only in the COVID ward, but also sa non-COVID. Kasi we don't know na, di ba? Minsan, by experience, over a year na po tayong ganito, ang dami pa rin nakakatakas sa non-COVID na COVID pala. So, air purifiers in the wards, that's a welcome idea. If we can afford it, it's very welcome, right? Basta anything to improve our ventilation. If there are windows in the hallways, open it. Open those windows. If there are windows in your office, open those windows. Di bali nang medyo mainit ng konti, hindi masyadong malakas yung aircon. But at least your air is circulating. Alright? So, negative pressures, ano yan? Best recommendation. No? But of course, hindi naman lahat ganun kabilis makapag-comply. Pero at least the air purifiers, sa yung idea. So sa mga natin, sa admin natin sa hospitals, you can discuss it if we can afford it. And then, yun nga, opening of windows, opening of doors. But of course, not to sacrifice security. All right, so clean the air. Yun, ito, isa pang possible way, no, to prevent transmission. Work from home. Hindi ko po kasi alam. Personally, I'm not familiar of yung sa mga offices ng hospitals. But if we can encourage more work from home, that would be better. Less personnel in the hospital. Of course, but not sacrificing naman yung function, di ba po? Because if you're work from home, flexible yung schedule, walang magko-commute, no, lesser exposure to others, no, and probably potentially infectious workmates. So there are advantages of work from home. So isa po ito sa, nagsulat si Ma'am April. Okay, so isa po ito sa option. So I'm trying to put up ideas out there that we can do, no, for our respective hospitals. Of course, you are to choose which ones are applicable to you. But this one is a good option, a good idea, I think. All right, next is, ayun, ito for individuals. Please don't go to work even if you feel, ano ba to? Even a bit sick, mali yung grammar ko, no? Ito po kasi, common cause yan ng natin, mga transmission. Ang hirap sabihin, pero siguro sometimes mapapakamot na lang ng ulo, hindi pa ba tayo natututo? Mahigit 1 taon na, hindi pa rin natututo. May pag nag-contact trace, nakita mo, pumasok, meron na palang sipon. No? Of course, again, this is easier said than done. But let's think of our social responsibility. You have to protect your workmates also. If you feel a bit sick, magsabi po kagad kayo sa clinic. Don't go to work kaagad. And if they advise you that, sige, huwag ka na lang muna, I'm sure most of the time, sasabihin nila, don't go to work. No? And, syempre, thinking from an employee standpoint, of course, they will need administrative support. I can't really give much advice here, no? Pero, alam niyo na po yun. Administrative support for these employees who may not be able to work in days when they feel bad. Of course, sabi ko nga po sa inyo, social responsibility yan. Please do not abuse it naman. No? Please do not abuse this setup. Now, more losses kapag pumasok po tayo, tapos ang dami pang nahawa, no? There will be more losses. And ito, naglagay na po ako dito, reprimand. That may eventually be an option if talagang naging catastrophic ang scenario na pumasok si Juan at nahawa niya ang buong office at nawala yung function ng buong office, hindi ko po masisisi kung maiisip na may reprimand na kailangan, no? But of course, we don't want to go there. That's why this is just a reminder, no? Individually, if you don't feel well, if you think you have these symptoms, might as well rest, stay at home, get tested before you go to work. Right? And the last one, I think this is the last one. Vaccinate. Okay. Ito, I'd like to show you a little more information on this. So vaccinate. Why do we have to get the vaccine? We have lesser infections. If you have lesser infections, there are lesser mutations. And if there are lesser infections, less hospitalizations, and lesser deaths. It is known, general information right now, general data is that vaccinated individuals have a tendency to have less severe symptoms. They have lesser tendency to get hospitalized. So the cases may go up, but deaths will eventually decline. And we have data on this in, I think it's European data that showed even if dumami yung mga kaso nila, yung deaths nila stable lang sa baba. No? So again, we are not only stewards of ourselves. So kung tayo, lalo na po yung mga doctors, most of us probably are vaccinated, and let us all be stewards of others. Encourage people to vaccinate, okay? Or to get vaccinated. All right. So here I'd like to show you a few articles that I've stumbled upon regarding vaccination and the Delta variant or other variants. So here, okay, I got this from New England Journal of Medicine. They investigated the effectiveness of Pfizer and AstraZeneca against the Delta variant. And here they showed interesting data. Ang ganda po ng data nila. So, ang saya-saya ng mga naka-Pfizer at saka naka-Astra. Oh. They found that those who had one dose of Pfizer had 48.7% protection against symptomatic disease, while sa Delta, lesser. So you would see, no, there's a comparison, talagang lesser protection against the Delta variant, even if the mRNA vaccines are in question. But if you are vaccinated fully with the Pfizer vaccine, it gives you 93 or around 94% protection against the UK variant or the Alpha variant, and 88% protection against symptomatic Delta disease. This is actually quite remarkable. No? What about the AstraZeneca? Basically, the trend is also the same. Pag one dose, nasa around 30 to 40% lang against Delta and Alpha. But if you have two doses of, if you're fully vaccinated with the AstraZeneca vaccine, it gives you 74.5% protection against the Alpha or UK variant and 67% against the Delta variant. This is actually still quite good, above 50%. So maganda po ito. No? But this is just for the Pfizer and AstraZeneca. Alam naman po natin, karamihan tayo dito sa audience. Malamang Sinovac tayo lahat. No? So let me present to you some data on Sinovac. So Sinovac or CoronaVac. Ito po, this slide, I got this from WHO. This is the data that we held on to prior to the variants coming. So ito po yung rationale why Sinovac was actually endorsed or approved by the FDA. So as you might notice, there are three important sites where the CoronaVac phase 3 trials were held. So Brazil, Turkey, and Indonesia. And so far, the vaccine efficacy for Sinovac ranges from 51 to 84%. Ito pong 51%, there's a bit, a bit of an explanation because the individuals who were included in the study were actually healthcare workers who were taking care of COVID-19 patients. So naturally, compared to the general population, they have a tendency to have higher rates of infection. And that's why probably this is just 51%, but still above the 50% cutoff. But if you would go to the vaccine efficacy against severe COVID, maganda po naman talaga ang data ng Sinovac, which is 100% protection against severe COVID infection and death. Right? So this is the initial Sinovac data. What about nung dumating yung mga variants? So, oops, meron pala akong ganyan. All right. So, nung dumating naman yung mga variant, actually at this point, well, at least with the literature that I've searched, medyo limited pa po yung mga studies that can guide us on its efficacy against the Delta variant. But we have a little data on its efficacy against the Brazil and the UK variant. And it says here that there was 67% protection against symptomatic COVID. So, for example, sinipon. So that's symptomatic COVID kagad. But hospitalization, it has a 85 to 100% protection against hospitalization for COVID infection or basically moderate to severe disease. So ito po yung data that we have now. This is from SAGE, WHO data. And we look forward, hopefully, sa mas robust information. And probably by that time, probably I can share it again with you at a venue like this. Right? So sa Sinovac, that's Sinovac. Okay, eto naman. I don't want to scare anybody, but I also stumbled upon this article. Again, this is a preprint. And what they did here is this is an in vivo study. It's entitled SARS-CoV-2 Variants of Concern Exhibit Reduced Sensitivity to Live Virus Neutralization in Sera from CoronaVac vaccinees and naturally infected COVID-19 patients. Let me digest that with you. So they investigated the ability of the serum of patients who were immunized with Sinovac or with CoronaVac and comparing them also with naturally infected COVID-19 patients. So they took the sera of these individuals and they tested for live virus neutralization. So if you remember the principle that I taught you earlier, neutralizing antibodies are the antibodies that are able to contra the virus. So these are the bodies that are protective. No? So when they got the sera of these patients, they assessed the neutralizing antibody potency against the usual strain of the SARS-CoV-2, so the original strain of the SARS-CoV-2, and compared its ability to neutralize the virus na variant of concern. So against the three variants of concern. Again, the three variants of concern are UK, South African, and Indian, right? So what were the results? So here they found that despite equally robust production of binding IgG and 100% seropositivity ng mga CoronaVac vaccinees and post-COVID patients. So all of them had antibodies. But there was significantly reduced neutralizing capacity against all three variants of concern compared to the original virus. What does that mean? Ibig sabihin lang medyo mas matalino talaga yung variants of concern that they can evade the neutralizing capacity of the antibodies of these patients. And who are these patients in this study? Those who were post-COVID and those who were post-CoronaVac vaccination. It's interesting. Strikingly, no, neutralizing antibody titers against alpha and beta were comparable, but delta appears to be significantly more refractory, mas makunat, mas makulit, mas mahirap i-neutralize, no, ng neutralizing antibodies in all groups. Okay, so again, that emphasizes, for me, talagang kailangan ko mag-ingat against the Delta virus. But again, I'd like to remind you, this is a preprint. It's an in vitro study, and there is still cell-mediated immunity that can protect us. No? It has a strong role in immunity. No? Hindi lang po tayo puro antibodies. Our cell-mediated immunity, our memory cells, they still play a strong role against infection. All right. And this is not measured in this study. Okay. Here naman, this is Indian data naman. Ito medyo good news to. Clinical outcomes in vaccinated individuals hospitalized with the Delta variant. So here, they looked into the clinical profiles and outcomes of more than 1,000 COVID-19 patients who were hospitalized. And these patients were vaccinated with Covishield, Chadox 1, basically AstraZeneca, and Covaxin. Covaxin, if not everybody is familiar, Covaxin po is an inactivated COVID vaccine. Para po siyang comparable to CoronaVac. No? It's also FDA approved already. No? Meron na po yung EUA dito sa Pilipinas. Hindi pa lang po siya na-roll out. Pero Covaxin basically is inactivated virus. So they were vaccinated with Covishield or Covaxin. So itong more than 1,000 patients na to, more than 90% in both groups were harboring the Delta variant. Indian data to eh. So more than 90% Delta variant sila. So what were the results of this study? Ito, ang ganda. So the results showed that the vaccinated individuals with the Chadox or the Covaxin showed a significant, ito level of significance ng p-value for those who are not familiar. Level of neutralizing antibody was significantly higher, 545 compared to 51. Serum ferritin levels were significantly lower. Serum LDH was significantly lower also, meaning these are markers of inflammation. And naturally, it's not surprising. The severity of the disease was also significantly lower in the vaccinated group. The requirement for MEC vent support was also significantly lower compared to the unvaccinated group, and the mortality was half. And if that's not promising enough, this is Indian data, and we all know that they suffered Delta the most. I think this gives us a glimpse of hope. And this pushes us further. Get vaccinated, whatever vaccine it is, because there is really advantage in getting your shot. All right. So again, vaccinate, 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 because vaccines save lives. It's for a fact. It's applicable for any vaccine preventable infectious disease, right? So again, let us be stewards, encourage everyone to get vaccinated. One other, hindi pa pala yun yung last, no? One other idea in my mind is, what about regular testing? Should we proceed with regular monitoring of frontliners? Of course, this should be guided by IATF guidelines, DOH policies, etc. But if we want to get an idea of those infected, wouldn't that mean that we should test regularly? Test as much as we can? That's one idea that I'd like to put out there. And for those with suspected Delta variants, kasi hindi naman lahat na genome sequence. We all know how difficult it is for genome sequencing, right? So for those even suspected Delta variants, should we repeat testing before release from isolation? I know recently DOH or IATF, I think, released a memorandum that before these Delta variants are released from isolation, they should have a negative test. So fine, wala na tayong magagawa about it. But what about those who are suspected? Hindi pa natin alam na Delta siya. Pero if we have that inclination, for those seeing COVID patients here, maybe we can talk about it. Let's talk about it when we see each other in the wards. Okay? So who are these Delta variant suspects? Nag-coin na ako ng sarili kong term. No? Those who are returning OFWs, those with reinfection, nagkaroon na last 2020, ngayon meron naman. Those who have breakthrough infections after vaccination. Fully vaccinated na to, doktora pero timo severe disease pa rin. So that for me is already a clue. Maybe I should have genome sequencing, right? And those who have severe to critical cases, especially those who are in clusters. So ito po, idea lang po ito. We can discuss more about it if you're interested, especially for those who are regularly seeing COVID-19 patients. Maybe we can work together and come up with a guideline, no? For our own local scenario. All right? And then the last one, I think the most important one is to pray. Ito talaga last because this is the most powerful. Sa lahat ho ng mga slides ko kanina, wala yun lahat if we do not do this. This is the most powerful amongst our defenses. Remember, in Psalm 107:29, He made the storm be still. How powerful is that? How powerful is that? Na kahit imposible, at just one click of a finger, kaya po niyang tanggalin ng lahat. So, we all pray for the safety of each other, for our loved ones, for our country. No? And in our own little way, we contribute to each other's safety. All right, so I think really that's my last slide. Thank you. Okay, maraming salamat po. I'm now open for your questions and suggestions.
Okay, may we call on again Dr. Florence Santos to moderate our symposium.
Okay, thank you very much, Jade, for those very practical issues that you have tackled. We have a lot of questions in the chat box, so I would just like to read first. Okay, so there's a question here. What are the latest issues, guidelines on possible booster doses for COVID vaccine?
Okay. Thank you very much for that question, Miss Universe and the doc. Well, guidelines, wala pa pong guidelines. At least now, no. But there are some data already that there's promise in having booster doses. Kanina lang, I read one article. Sorry, I didn't have time to include it in this presentation. But there's data now that Sinovac can have a third dose already at 6 to 8 months. This is being studied already in China. 6 to 8 months after completing the vaccination, they found that there was a more robust antibody titer, neutralizing antibody titer. So that's one. That's something to look forward to. Booster shots also from AstraZeneca, then a booster from Pfizer. There's data on that. And also, I think Pfizer, sa ibang bansa po, Pfizer completed the vaccination, another Pfizer. No? But usually after 6 to 8 months of completing the vaccine. In general, the data that I've read shows that naturally, hindi naman surprising, tataas talaga yung antibody mo. No? But yun pong mga data na yon, it doesn't translate yet to added protection against infection. They just found that mas matataas talaga yung neutralizing antibody titers. But in the real world scenario, na meron na tayong data na talagang nakaprevent siya ng severe disease, that's what I am waiting for. If I have that data already, again, I'd volunteer a lecture for you. Yun po. Okay, so there's promise in that though.
Okay, so since we do not have data yet, no mix matching, but I think they're doing it in some countries na, no, Jade?
Yes, Dr. Opo.
Okay, so this is from Dr. Ana Palacios. I'm not sure if this is question. Are we to say that we are okay with the Sinovac vaccine?
Okay. Hindi po okay yung sagot ko. Ganito po. First is, what is the definition of okay, Dr. Ana? Kasi, sa akin, personally, as long as I have my defenses, other defenses like yung PPE ko and other precautions, my opinion only, I am okay with Sinovac. At this point in time, I am okay with Sinovac. However, it still is to be taken with precaution. because kagaya po nung nakita, na pinresent ko po sa inyo na data kanina, that coronavac vaccinees have yung neutralization ability niya sa mga live virus, although it was an in vivo study, lesser po yung activity niya against the Delta variant and the other variants of concern for that matter. So right now, as we speak, we are okay, but there may come a time that we are not. So let us keep ourselves open for the possibility of boosting and another dose of a different vaccine. Personally, sa akin po kasi, so ako po, Sinovac, trying to put in the science of vaccinology. So meron ako Sinovac. I would like to receive another vaccine kasi that will trigger a different immune response. Rather than getting the same vaccine, will just give me the same response. You understand? I hope you do. Medyo magulo yata po. No? Pero kung iba po yung antigen na mai-present sa akin, then probably I would have a different immune response and probably a more robust immune response at that. So yun po. I think that's the near future of vaccination in the Philippines.
Okay, so parang K-drama, no? When is it, ano yan? Okay, when, ano ba yun? Is it
Okay,
okay
when,
okay?
ano ba yun? Ano yun nga?
Anyway, okay, there's another question, but I think this was answered now with regards to the combination, yung another brand. There's a question from Doctora Publico. I think this is one of the most disturbing also messages that we received this morning sa Viber, no? Being a silent, the Delta being silent. So please comment po if one gets negative RT-PCR, there's still probability that one has Delta virus. Diba? Yung kaninang na-receive natin sa Viber, diba yung sabi nila na Delta virus can actually show a negative RT-PCR, but then it goes straight to the lung. So how would you comment on that?
Okay. Again, I'll go back to the mutations, the principles of mutations, Doctora. Kasi ang mutations kasi for the dominant strains more especially, it gives the virus more power, no? It makes it more fit. And one of those is faster transmission, it's able to evade the defenses. And another possibility is actually to be able to be incognito sa PCR. Because how does that happen? If the mutation occurs in the site, which are primers for RT-PCR. So kung hindi siya madedetect ng RT-PCR, walang ma-replicate, walang ma-amplify yung RT-PCR. So really, it can be a possibility. It actually is scary, Doctora, but if I am to be objective about it, there's not much data on it yet. No? I think yun yung pinakasikat na answer eh. No? Wala, not much data because that's the truth. But it's something to be cautious about. So for those who are handling patients, again, we all go back to yung tinuro po sa atin sa med school. Clinical assessment. Ito pong mga tests na ito, these are just here to guide us. But our judgment as doctors, as clinicians, should always prevail. For those who have severe to critical illness, we've gone through this several times. Even if negative po sila, kung mukhang COVID, treat as COVID. The question is, what if mild lang siya? No? Well, kung mild lang siya, you still advise home isolation. So hindi naman kailangan na may gamot or highfalutin na mga medicines, investigational drugs. But the key here to control transmission is really isolation. So even if the RT-PCR is negative, still advise your patient to isolate. That's my answer.
Okay. Another question. The study in India uses inactivated virus. If it is so, and with promising result against Delta, isn't it Sinovac also uses inactivated virus? So parang kino-correlate lang niya yung inactivated virus used in Sinovac with the inactivated virus of Delta. So how would you comment on that?
Um, in theory, yes. Yun po yung nakikita kong light doon sa data na if they were jabbed with inactivated viruses and the Delta virus, their clinical outcome, yun po kasi yung gusto ko sa paper na yun eh. They presented clinical outcomes rather than yung mga antibody levels, etc. No? They showed what really happened to the patients. And that's what we're after. We're not measuring our antibodies. We are looking. Kim, mute ka muna, Kim. We are after the clinical outcome. So, dun po sa my comment on that is that's a promise that I'd like to hold on to with that study. If dun sa study na yon, inactivated virus yung ginamit na vaccine, Sinovac is also like that. So, in theory, that's still a possibility for us.
Okay. So, I think the question of Dr. Panopio, yung with regards to the booster of 6 months had been answered na for Sinovac. So it's undergoing na yung study, no, Jade?
Yes,
for the
meron na po.
Question from Dr. Villares. What vaccine would be advisable? 90-year-old female, hypothyroid, hypertensive, and 93-year-old male, hypothyroid with prostate cancer.
Doktora, hypothyroid. Meron kang suggestion?
Preference.
Actually, I don't want to sound cliche but whatever vaccines available, each vaccine has its risk, no? And the reactogenicity of the mRNA and the viral vector vaccines are higher compared to the CoronaVac or the Sinovac. So you really weigh the circumstances. If these 90-year-old parents do not have risk for getting COVID, like for example, they're only at home, wala silang frontliner na kasama sa bahay, walang masyadong lumalabas sa bahay, then actually, I don't think it should matter na kailangan yung mga matataas na numbers ng efficacy meron sila. No? So, sa tingin ko po, it's really a balance between what's available, that's number one, the possibility of reactogenic infections, that's number two, and of course, considering the vaccine efficacy of the vaccines available. Kung takot naman po kayo na paturukan mayat maya yung mga 90-year-old, J&J is a good option para isang shot lang po sila.
Yes, I agree. Have you had any further readings with regards to the thrombosis of the Astra vaccine? Kasi di ba may mga patients who have chronic venous insufficiency, may mga varicosities, na minsan tatanungin, Doktor, pwede po ba sa akin ang Astra vaccine? Kasi yun nga lang yung available. Do you have any other further
Yes, Doc.
that?
Actually, Doc, yung thrombosis ng thrombocytopenic thrombosis na associated sa AstraZeneca. The correct term there is associated.
Ikaw, uwi lang. Ay ba, nandito ng pagkain ng handa na. Ano lang yung nagwe-webinar?
Elva.
Ma'am Elva, pamute naman.
Binabayaran mo yan, 7,000.
Okay, yan. Salamat. Pasensya na po sa na-mute. Okay, so it's more common in younger individuals and females. I think the keyword here, Doctora, is association, not causality. So if everybody gets it, they may be associated, but it doesn't necessarily mean that Astra causes that phenomenon. Pero yun nga, nung nakita nila na maraming nag-develop ng ganito after Astra, that really was an alarm for the AZ vaccinees. So more common, also it's more common in the CNS and also GI, mesenteric. So yun po yung mga thrombosis na nakikita sa kanila. And mas common po sila sa venous kesa sa arterial na circulation. So Para po sa mga varicosities, yung mga patients na may varicosities, I don't see any major contraindication in those patients. Even if, pati po dun sa mga patients na may history ng thrombocytopenia, no, the literature that I've read and through the webinars also na natutunan ko po, those are not major contraindications to get the vaccine. The benefits still outweigh the risk. Yes. And these thrombotic events are associated with thrombocytopenia. So halimbawa, nagkaroon ng stroke. Example lang po, no? Stroke. After the AstraZeneca, tapos walang thrombocytopenia, that's not likely. Especially that arterial po yun. It's more common in the venous circulation of the CNS, particularly cavernous sinus thrombosis.
Okay, thank you. Okay, another question. Ilang minutes po ang nagstay sa air ang Delta variant?
Wala pa po siya talaga sa WHO. Hindi ko sa WHO nabasa, pero I think as long, anecdotal po ito ha, as long as 12 to 16 hours, yung pong nabasa ko. It's not a major article. Tapos, I think it's Australian data. Tapos, there was, I'm trying to recall, yung health minister nila, they said, yung reports ng sa contact tracing, even 90 seconds of exposure, ina-associate nila with viral transmission. But again, single country data po ito. No? So we still would have to wait for stronger literature.
Okay. How does it, Doctor, does it help if vaccines for COVID is augmented with flu and pneumococcal vaccine?
Clinically, yes. It should be beneficial because your patient is protected against multiple pathogens. No, yun po yung ano niya, major benefit niya. But I think I've encountered isa lang po yung article na nabasa ko na sinabi nila that those who had flu vaccines that were vaccinated by COVID had more robust antibody titers. Although isa lang po siya, hindi po siya masyadong sumikat. And sorry po, nakalimutan ko na rin po yung article na yun. Pero the major benefit in vaccinating with flu and pneumococcal is because your patients are protected against multiple pathogens. That's it.
Okay. Can you once and for all clarify with regards to the timing, the interval? Because diba kasi flu season, so giving you flu na rin ngayon yung mga time na to, and then here's the rollout of the COVID vaccine. What would be the best interval with regards to giving the flu, the pneumococcal, and the COVID vaccine? Kung gusto ng pasyenteng lahat, makuha niya yung vaccines na yan.
Opo. Talagang isa. Sabay-sabay, isa pa sa puwet. Actually po, originally, no, the guide was 14 days interval between the COVID vaccine before and after. But that was because WHO was being was taking extra precautions. Hindi kasi nila alam kung magiging harmful. So might as well err on the safe side, right? But recently, I think around June, the CDC released the guidance that there is no recommended interval anymore. So you can have the COVID vaccine together with the flu, together with the pneumococcal, because again, these vaccine preventable diseases are also priority. And kagaya po ng sabi ni Dr. Florence, lalo ngayon, flu season, so might as well have all your patients, especially those with comorbids, vaccinated with the flu vaccine. So wala pong recommended wala pong interval na kinakailangan. The PSMID gave a statement regarding this also. Medyo lengthy po siya. I think 2 or 3 pages. No? I think it was posted in BMS. Basically, ang sinasabi lang po doon is that syempre sinabi yung history, ganyan. And it's enough. If we are to vaccinate our patients with multiple different pathogen vaccines, we should also explain to them that we don't have any data yet regarding the vaccine efficacy being affected by one vaccine. no? So, yun lang naman po. So, we can vaccinate them, pero explain natin na hindi pa po kasi natin alam kung maaapektuhan nito yung vaccine efficacy ng COVID vaccine or vice versa. But it's safe naman po to vaccinate you in one sitting. Kasi minsan, lalo na Dr. Florence, di ba, minsan may mga taga-bukid pa tayo na patient, bago pa po sila makabalik sa clinic, ang tagal. So, take the opportunity to vaccinate the soonest.
Okay. Question ni Dr. Ating, after the second dose of vaccine, when would be the ideal time to operate on elective cases?
Elective cases? Well, wait. Sino po nagpabakuna? Yung doctor or yung patient?
Yung patient siguro.
Okay.
Yung patient. Yung patient.
Actually, kung ano naman po, anytime, basta fully vaccinated po yung patient, which is 2 weeks after the second dose, or if J&J, 2 weeks after the first dose, fully vaccinated na siya, you can already do your operation. Hindi naman po siya major contraindication or magkakaroon ng effect. No? At least wala naman pong ganun na data ngayon.
Okay. Ito, mukhang J&J ang naging vaccine ito eh. Okay, is there already data for J&J vaccine versus the Delta variant?
My answer, wala po. Wala pa po ako na-encounter. Most of the studies that I've seen as I was making my lecture, Pfizer, AstraZeneca, and ito na, syempre I specifically searched for Sinovac. So yun po.
Pero di ba kung ita-translate mo kung Astra kasi and J&J, di ba? Sila yung parehong adenovirus, di ba?
Viral vector din po sila.
Oo.
Yes.
So baka somehow, wala pa lang sigurong studies.
Hopefully.
Question ni Dr. Torio, is it time to start rolling out boosters against Delta? What about the children?
I don't think I'm the best person to answer this, Doctora. Kasi ang dami pong ang dami pang data na kailangan. For those who were initially vaccinated ng March 5, kailan nga ba ako una? March 5, March 8, something like that. Siguro the best time to evaluate this is 6 to 8 months after completing the vaccination. So right now po, Doctora, I think it's still early, no, for us to get our boosters. Boosters usually po 6 months after completing the vaccination, so after the second shot.
Okay. Jade, what about the children? I think sa iba, di ba, they are giving...
Pfizer po yung meron, yung may study. Kasi originally, ang Pfizer po is 16 and above. So, yun po, sila po yung may pinakabata na initial na enroll. Tapos, ngayon po, sila rin po yung nauna na mas bata, lower than 16.
Lower than 16.
So, and correct me, can add data on this. I think the data is very promising. Maganda po yung initial na outcomes. Although, hindi pa po tapos yung study.
So, intermission muna, what camera daw ang ginagamit mo kasi ang ganda mo daw sa screen. Sabi
wow! Baka malabo lang yung camera mo.
Okay, next one. Please, Dr. Ating, just stop me if it's time out na. Okay, ito pa. Possible po bang maging carrier ang newborn to 1-month-old baby ng Delta virus? Ask ko lang po kasi kumukuha po kami ng hindi ko mabasa, ng NBS, newborn screening ba to?
Newborn screening?
Screening test sa mga babies delivered from other hospital na walang screening and wala din po kami data from relative.
Okay. Well, if you are to be strict about it, live human, pwede po siyang maging carrier. No? Pwede siyang maging carrier. The question, I think, the more important question here is, should we test them? Yun know, yung importante, di ba? Making it a practical issue. Sa totoo lang po, kung yung namang ating encounter sa kanila is hindi naman siya high risk, meaning pwede naman nating kumaga we are wearing our complete PPE, newborn screening lang naman yon, hindi naman po mabilis na you call this, hindi naman po matagal na procedure, wala pong aerosolizing procedure. We can protect ourselves rather than subjecting a newborn to, for me po, unnecessary testing pa po siya.
Okay. Other than hospital concerns daw, may I ask po, since concerned din po kami sa mga anak namin, what can you say about some schools who will conduct, that will conduct limited face-to-face classes na this semester amidst the rise in Delta variant? So I think some schools kasi, they're going to be blended na. Half is face-to-face and half will be virtual. So,
my personal opinion, I don't think we're ready yet. Lalo na po ngayon na yung Delta is on the rise. Strictly speaking, today, parang padami po yung kaso natin eh. So, I don't think we're ready yet. So maybe if you have any connection with the schools, maybe it's time to re-evaluate. Kasi I'm sure that decision came from at least 2 weeks from today. Hindi naman yan ngayon nag-decide tapos kinabukasan, okay, blended. They had to plan it. So yung decision na yan po, hindi po yan recent. So I think they should re-evaluate.
Yes. It was siguro noon pa, before the Delta variant. It was, I think si Dr. Maldonado has plans of getting a Pfizer booster. So comment daw on mixed vaccine. So I think you already discussed this, di ba? Yung Sinovac daw then Pfizer. Parang wala pa, no? Sinovac is more on having their own booster, no?
Apo.
Sinovac. Pero wala pa yung Sinovac then Pfizer. So yun nga, we would just like to reiterate sa ibang countries, like Astra, Pfizer, Astra. So yun yung mga nami-mix and match nila. But then Sinovac, wala pa.
I also like to emphasize din, Doktora, minsan na-misinterpret kasi siya na booster. Pero actually, yung iba kasing studies, first dose Astra, second dose Pfizer.
Yes.
So hindi siya actually booster. That's the mix-match study.
Yeah, mix-match siya. Then ito pa, same din, got Astra, can have second dose of Sinovac. So, wala pa rin, no?
Wala pa rin.
Yung data dyan. Okay. Efficacy of J&J vaccine.
Ano pong question?
Efficacy of J&J vaccine.
Parang parang 90 plus din po siya. I'll get back to you on that. Pero I think it is also 96 ba? Hindi ko po maalala sa ngayon. Assignment ko po. I'll answer you.
Jade, ito, isang question po. Occurrence of GBS in J&J. Diba? Neurological ba ang mga ng J&J or it's more on Moderna and Pfizer?
Sa Moderna and actually anecdotal din po yan, yung GBS on J&J. Sa Pfizer po, I think hindi GBS one case of rheumatoid arthritis, tapos nagkaroon na some form of cancer. Pero di ba po isipin mo parang cancer, parang hindi naman causal, walang causality. So J&J, anecdotal po yung GBS, not proven. Tsaka sa dami po medyo hindi po masyadong marami yung nabavaccinate ng J&J. I don't think that much data can be significant as of today.
Okay. A question, Dr. Magnay, how about the Lambda variant? Sabi ko nga sa'yo, parang fraternity na eh.
Nga po
Delta na. May Lambda pa. I think
yes,
Lambda is also on the rise, no? Pero hindi pa
yes,
rin.
Wala pa naman po siya. Actually, more than the Lambda, meron pa tayong Delta Plus eh. So before we move on, parang iPhone na rin siya. So ano ba yan? Fraternity or iPhone? So, well, isa pong notorious na ina-anticipate is also the Lambda. But because in the real world scenario, it is the Delta variant that is rising exponentially and becoming the dominant strain. Ito po talaga yung binibigyang emphasis globally. But yes, yung Lambda po is also a big threat.
Yes. Another question from Dr. Espino is, which is better, double surgical mask or surgical mask covered with cloth mask?
Oh, Doctora, I cannot answer this objectively because there's no data about it. Hindi po siya siguro, wala po siyang yung pinag-aralan na numbers, percentage, but the most important po kasi in a mask is the fit. So even if meron po kayong double na mask, pero ang luwag naman dito, compared to a mask na single lang siya, pero ano siya, maganda po yung fit, that will be the better mask even if mag-isa. But if we are to compare surgical versus surgical cloth, I think because mas maganda yung evidence sa surgical mask rather than the cloth, double surgical kesa po surgical and cloth. No, well fitted.
Okay. Question ni Dr. Maya. Okay, after the full vaccination nung isang brand, for example, then when would be the best time to have another, I think ito yung question, to have another vaccine? Ay, ano ba yun? Another, siguro parang booster din to eh. Kailan po ang best time magpa-vaccine after being fully vaccinated with the first vaccine? So I think she was referring yung kanina minention mo about 6 months to 8 months.
8 months. Opo.
8 months.
A minimum of 6 months po. Yung mga studies na yun. Na yung mga studies po na yun, wala pa sila ang conclusion.
Pero I still believe, Jade, ano to eh, it's going to be a yearly thing na, no? Yung parang flu vaccine.
Me too.
Eventually. Okay, so another question, Doctora, if the patient po is due for the second dose, however, she was bitten by a dog, can we delay the second dose of COVID vaccine and give the anti-rabies vaccine, tetanus toxoid, etc., etc., etc.? The bite is category 3 po and a known tetanus immunization history.
Okay. So, if I'll read between the lines, the patient category 3 and unknown tetanus history, you're trying to imply po, Doctora, that the patient has to receive tetanus immunoglobulin and equine rabies immunoglobulin. No? So, ibig sabihin po, merong immunoglobulin shot yung patient. Okay. So, choosing between the more deadly virus, pupunta po ako sa rabies. Okay? So, I would prioritize the rabies shots first, and I will delay the COVID vaccine. Just for the reason na ibigyan po kasi siya ng immunoglobulin. Kapag po kasi nagbigyan ng immunoglobulin containing material ang isang patient, that will significantly lower your immune response to a certain vaccine. That's a basic of vaccinology. Okay? So, halimbawa po, nabigyan ka ng immunoglobulin or nasalinan ka ng dugo, nasalinan ka ng plasma. These are antibody-containing materials. So, it's reason for you to delay immunization for at least 90 days. Okay? So, yun po yung reason doon. But, if you will tell me na wala pong immunoglobulin na maibigay, and for example, category 1 bite, gusto lang talaga magpa-vaccine, tapos may previous tetanus immunization na, so hindi kailangan ng antibody, you may give the rabies vaccine and then follow the usual course of your COVID vaccine. You don't have to delay for 90 days.
Okay. Another question. Do you recommend us to undergo swab testing? We've been in 4 days quarantine and without symptoms. We are fully vaccinated. Hindi ko masyadong nagets. Nagets mo ba? Undergo swab testing and then quarantine. Paki-clarify na lang po, Ms. Caroline Caballes. And then another, related, 2 questions na related eh. COVID vaccine in pregnant women. Tapos merong isang patient na nagpa-vaccinate and then becomes pregnant pala before the second dose. So what would be the advice to these patients in general?
Okay. Sige. In general, our OB mentors, my OB mentors can also augment my answer. In general, pregnancy is not a contraindication to vaccination. Ang hindi po pwede, Gamaleya. So, syempre, Sputnik out na yan sa mga buntis. No? So, kung bawa nabuntis siya and due for the second dose, ako po kasi kahit pasabihin mo ang pregnancy, hindi contraindication. Kapag po kasi nasa first trimester, kung ako yung buntis, I wouldn't want to risk it. Kasi nandun yung organogenesis ng anak ko. I don't want any immunization pa. That's me. Ako po yon. Pero kung halimbawa, buntis ka na and you're a high-risk healthcare worker, example, you're a nurse or you work in the hospital for whatever reason, it's not a contraindication to get vaccinated, except Sputnik vaccine. So yun po. I think I would appreciate the opinion of our OB doctors here na kung sa first trimester, ako po, I would rather delay the second dose at least past the first trimester kung talagang gusto niyang kompletuhin yung COVID vaccine. The principles ng COVID vaccination, of course, the ideal is to get your second dose at the time na nakaschedule siya. But if you can't, for whatever reason, you may get it the earliest time that is possible. Ganun naman po talaga sa lahat ng mga bakuna. You don't have to restart. You don't have to restart. What you don't want is to get the vaccine earlier than the scheduled dose. So yun po yung mas problematic kesa sa mahuhuli yung vaccine.
Okay. So I hope Jade was able to answer your questions po. Okay, question ni Dr. Magnay, how about the possible adverse event if simultaneous vaccinations? I think doctor is referring here siguro flu and then COVID vaccine, no? Which vaccine to attribute the adverse event?
We can't say, Doc. We can't say. That's why prior to vaccination, your patient should be well informed. Na okay, ito po pwede na nating sabay, pero just in case mangati kayo, magka-rashes kayo, hindi po natin malalaman. So we really can't say that.
Okay. With the height of Delta variant, do we still consider the timing of testing for asymptomatic close contact?
Yes, it will still be the same po. At least 5 days from the last exposure. So for example, you had your contact June 1. You count, so yun na yun. So nahiwalay na June 1. June 2 is day 1. Then you count. Tapos 5 to 7 days after the last exposure, that is the best time to do your swab.
I thought shorter. Parang meron ako nabasa, parang 3 to 5 days. Or,
alin
so
po
5 days pa rin.
Pag ano yan, symptomatic po ba sila?
Dito kasi asymptomatic yung question ni Doktora.
Symptomatic?
Asymptomatic.
Pag asymptomatic, Doc, at least 5 pa rin po yung guideline po.
Okay.
Kapag naman po symptomatic, well, you can swab naman the earliest na magkaroon ng symptoms. But by percentage, the highest yield will be during the 3rd to 5th day of symptoms.
Okay. Question ni Dr. Shira, any data on Covavax, the one to be rolled out by Unilab, and still seeking EUA about the efficacy and also against the Delta?
Ito ba yung nakita ko na, I'll get back to you on that, Dr. Shira. Pero sa nakita ko po dun sa Covavax, parang 94% vaccine efficacy. I'll get back to you po. I'll try to see now. Meron ako dito sa akin.
Jade, efficacy against Delta?
Oo, efficacy against Delta? Ay, wala po. Wala.
Kasi I think, pa to yung una pang mga variants ang na-study nila doon sa mga naro-roll out, no, na vaccine.
Opo. At saka po ganito, we have to put it into context kasi the present scenario is, yung pong mga vaccines na merong data against Delta, these are the vaccines that were rolled out to many individuals na nagkaroon ng Delta outbreaks. So if Covavax is not yet used in those countries, naturally, wala pong magiging data. So kaya ang mga may data lang talaga right now is Pfizer and AstraZeneca mostly. Kasi po sila yung pinaka-rolled out in the areas na nagkaroon ng Delta outbreak. Yan.
There's a question with regards to yung mga breastfeeding. So sa breast milk ba, nasa secret ba ang vaccine? Ang question kasi is, I think she's breastfeeding 2-month-old baby and then she got vaccinated. Same po bang efficacy na na-transfer ko sa baby? Parang vaccinated ako.
I don't have data to back up my answer, pero I'm assuming hindi po. Like for example, na meron akong, for example, I got Sinovac. Tapos kunwari meron akong 85%
protection, and then my baby will also have 85% protection. It doesn't go that way. So really, it would vary po.
Okay. Question with regards to yung delay ng second dose. So supposedly Sinovac, so dapat 1 month, no? So ang kanya daw is na-delay na ng 41 days until na wala pang available for second dose. Can she get another type of vaccine for the second dose?
Well, I think aside from me answering it, our health units will be the best to answer. Kasi can you get? Bibigyan ka ba?
Yes. Oo. Kasi naka-allot na yun din sa mga second dose or first doses. Ang question kasi would be, how long ba talaga yung pwedeng maghintay ng second dose? Kasi like sa Canada, the Pfizer dose is being given after 16 weeks pa eh. Di ba dito sa atin is 12 weeks, no? Sa kanila 16 weeks pa yung interval. So mga kanya-kanya ba sila na maximum tolerable interval?
Wala po siya dun sa nilalabas nila, Doc, na to my knowledge, Doc. Kasi ang recommendations ng mga trials, ng mga phase 3 trials, of course they are in phase 3 trials are done in controlled conditions. Okay? So naturally, hindi po siya makakapag-predict ng outcomes na wala dun sa controlled condition na yon, unless pag-aralan mo rin talaga yung ganong duration. Right? So itong mga vaccine efficacies na certain percentage, whatever, 90, 95, 94, these are under particular interval. So siguro per country lang talaga, I would be assuming at this point, siguro kaya po sila nagkaroon ng sariling protocol would be because it may have been influenced by vaccine availability. Para siguro po ma-prioritize nila na ma-first dose muna lahat bago po mag-second dose yung iba. So I think it's a matter of policy making also in that particular country.
Yes, that's correct. I think that's the case sa iba, no, na longer yung interval. Kasi ang goal nga nila talaga ma-vaccinate muna, mag-first vaccination muna yung majority for getting the second dose. May question dito. Doktora, compared to Spanish influenza, how do you see the current COVID disease ending?
Parang historic dapat yung maging sagot ko. Teka, mag-prepare ako. Right now, I really can't say po eh. As much as I want to see that, it will end in a year, in 2 years. Dami po kasing variants.
Daming factors. People now are more mobile, di ba? So, hindi mo talaga makontain yung mga tao. So,
and ang dami po kasing like for example, ang daming treatment na, like, for example, ivermectin, yung mga ganun ba? So, kanya-kanya po kasi ng mga protocols right now. With great knowledge comes great responsibility. Yes. So, ang hirap pong sabihin eh.
Okay. Is it safe to have Astra vaccine shot even if you took blood thinners weeks ago?
Blood thinners, example, will be antiplatelet?
I think so.
Yes. Actually, hindi naman po siya major contraindication. Although the Cardio Society they have a recommendation na kung naka-warfarin ka, you have to have an INR of less than 4 before you get the shot. But this, I think, is not necessarily because of the vaccine, but it's because of the injection. So para hindi ka mag-bleed or mag-hematoma dun sa injection. So less than 4 po yung what you call this, cut off. But for antiplatelets and the rest of the blood thinners, yes, you may take the shot.
Okay. Eto, when is the best time for a quantitative assay for antibodies after completion of vaccination? So is it really needed, Jay, to get the quantitative assay, or gusto mo lang yung sarili mo na makita na may antibodies, mount ka na ng antibodies?
The latter. Okay. When is the best time? Well, physiology will tell us that at around 6 to 12 weeks after exposure, no? Yun po doon po nagpipeak yung ating antibody formation for whatever pathogen it is, including a vaccine. As early as 2 weeks, pwede po tayong mag-check if you want to see. Now, pero, yun po is just to answer your question. But the more practical question is it really needed for me to prove na protektado talaga ako? The answer is, it is not recommended for you to get post-vaccination serum antibody levels. Okay? Again, hindi ko po masasabi na, bakit naman hindi pwede? Ganyan. It just, we have to understand that it's not only the antibodies that are protecting us. Exposure to these multiple antigens will also activate our cell-mediated immunity and will induce memory T and B cells that are not measured by laboratory tests. And also, even if you measure antibodies, for example, you have a high level of antibody, you wouldn't know what percentage of those antibodies will be neutralizing. So yun po yun eh. Marami pong areas in immunology na kailangan pong i-consider. But at the end of the day, if it will give you comfort, no, and if it will give you peace na, salamat, mataas yung antibody ko, then hindi naman po siya harmful. No? Matutusok ka nga lang, kukuhanan ka ng dugo. Pero you may check. As early as 2 weeks, pwede na pong magkaroon. Pero it is recommended, siguro mga 6 to 12 weeks after, mas maganda po yung yung levels niya.
Okay. A patient is due for her second dose COVID vaccine. However, she had shingles. So considered siguro immunocompromised. No? How soon can she get for the second dose?
Okay. Strictly speaking, if we go to the guidelines, yung mga contraindications po ng COVID-19 vaccine, shingles naman, hindi naman yan kasama doon eh. No? But putting it into the practical context, if your patient had shingles, di ba alam naman natin shingles is a reactivation of your varicella zoster virus. So there should be a trigger. Humina kaya ang resistensya nitong pasyenteng to ngayon. So what could that be? Hindi ba controlled ang sugars niya? Meron ba siya a surrogate marker of the patient's immune status at that present time? So kung bakunahan mo siya sa time na yun, baka hindi rin masyadong mataas yung maging response niya or immune response niya to the vaccine. So kung ako po yun, and also for my protection as a doctor, baka mamaya magkaroon pa ng major reaction, masisipa ako kasi pinabukunahan ko na may shingles. I would just wait for the shingles to resolve and until the patient is well, no, hindi naglalaknat, nakakakain ng maayos, and then the soonest possible time that she has recovered from the acute infection, pwede na po siyang bakunahan.
Okay. Shade, how about patients with lung cancer with metastases? Can they get COVID vaccine?
That is not a major contraindication, Doctora. Again, it's weighing between the risks of getting COVID and the protection po na mabibigay po nila. So, if there is an oncologist in the house, your comment will be welcome po. But technically speaking, yes, they may get vaccinated. Ang only contraindicated lang naman po sa kanila, having active malignancy, will be a live vaccine. And with the present vaccine choices that we have, wala naman pong live vaccine.
Okay. Another question, out of curiosity daw, I have seen some people wearing air purifiers. Is it applicable in this pandemic? Siguro sinasabi niya with regards to the speed of transmission ng Delta variant.
Not proven, Doc. Wala pong data dyan.
Okay.
Wala po siya before sa original strain, and ngayon sa Delta, I am also doubting.
Okay. So we're down to our last question. So from Dr. Magnaye, as a policy, can can we not have at least a few days separating schedule of multiple vaccines? Kasi nga we cannot pinpoint the possible adverse events.
Okay. In terms of policy making, hindi ko po kasi ma-imagine yung community na bibigyan natin ng policy na to. What do you mean? Us as Batangas Medical Society doctors, magkakaroon ng policy. Pero sa tingin ko po, I think this can be addressed by individual clinical assessment na lang po siguro. Like for example, si Dr. Santos, meron siyang patient, talagang matagal na niyang pasyente, kilala naman niya, low risk talaga sa, tapos previously, na-flu vaccine na naman niya, yearly siyang nag-flu vaccine. So kung magkaroon ng adverse effect, tapos may bagong vaccine, then it's readily identifiable that we can assume na dun siya sa bagong antigen nag-react. But in terms of policy making, I think this will entail siguro a bigger group to impose it. Kasi minsan, preferred din po minsan ng na sabay-sabay na Sure. Pero, yun. Nakawalang data kasi to back it up, Doc.
Okay.
Dr. Jade, excuse me.
Yes, Doc.
I think Dr. Monching Magnay is raising his hand.
Ay, sorry po, hindi ko po napansin.
Dr. Monching.
Doctor?
Elba, unmute mo si Doktor.
Doc, in-allowed ko na po yung audience na pwede po silang mag-unmute.
Okay, Dr. Monchi, you can... naka-unmute daw siya.
Pwede na siya, Doc, mag-unmute ng sarili po niya.
Hindi daw pwede.
Elba, minsan hindi ma-unmute.
Okay, sige, ako na pa maghanap kay Doktor. Wait lang po. Doc, nag-a-ask po ako sa inyong mag-unmute. Naka-mute pa rin po.
Ayaw talaga.
Dr. Magnaye, pwede na raw po kayo mag-unmute.
Naka-ano na po siya, naka-unmute na.
Okay, can you hear me now?
Yes.
Okay, now, ngayon lang ako na-unmute. Kanina, hindi talaga ma-unmute. Okay, with regards to the previously asked questions, or even as a practice, na, I don't know if it's a practice ngayon, I know there are guidelines before. Yung multiple, like a flu or COVID, yung malayo para sabay-sabay na. The problem, isn't it prudent na talagang mayroong separation of at least days? Kasi ang ating isang minomonitor, even na pa sa policy as a practice, is the adverse events. And one of the contraindication for a COVID vaccine to be given is a major adverse event. Kung nagsabay-sabay, tapos hindi naman siya sa COVID may allergy or may side effect, kundi sa ibang vaccine, you cannot tell. Now, that's the dilemma. Kaya, I don't know if I could, I will do that, na pagsasabay-sabay ko yung vaccination. Can we have some comments about that?
Yes, Doctor, can I comment? Well, actually, in my practice, Doctor, I also give like a month na interval. Like, for example, kasi nga vaccination, season. So, for example, the patient got COVID vaccine. So, usually I allot like 1 month before she gets the flu vaccine and then another month siguro for the pneumonia vaccine. Well, that's anecdotal lang. Sa akin lang yun. I don't know if the other would agree on giving that interval in giving multiple vaccines. Kasi nakakatakot din niya baka kasi masisi yung flu, masisi yung COVID vaccine, so hindi natin mapipinpoint. Well, I don't know, Jade, what's your opinion?
Sa akin, Doc, of course, I understand and I also will go for the separation. Kasi ang nangyayari naman din sa atin kasi, Doc, wala naman pong nagkakasabay talaga. Ang nagiging tanong po, kasi po hindi naman po mag-flu vaccine sa vaccination site ng COVID, di ba? Or hindi naman nakakapag-COVID vaccine ang isang clinician kapag nag-flu shot siya sa clinic. So wala talaga pong nagkakasabay ng same day unless pumunta siya dun sa clinic ng doktor after sa vaccination site.
Yeah, that's why I want it to be clear coming from you, because some may have a different perception. Kasi sabi nyo, sabay-sabay, para taga-bukid, para isa ng punta. So I hope that makes it clear that we are some basics that we'll have to consider. So it's that we cannot even put it in a policy, by practice na lang.
Yun. Actually, yun po yung point ko, Doc, eh. Hindi po siya pwedeng gawing policy. It's individual practice. Kasi yung question do kasi is, can we make a policy? I don't think we can make a policy. But by prudent practice, it is our responsibility to advise our individual patients.
Yeah, sorry if I get it wrong, kasi sometimes we get into policies, and when we have some feedback or at least a misperception that we're getting, baka wala namang policy, o ito pala yung policy na pwedeng sabay-sabay. So that makes it clear. Thank you, Jade, for bringing that out. Thank you, and Dr. Thank you.
Thank you po, Doctor. Thank you po. Jade, napansin mo din sa screening sheet ng sa City Health, 'di ba may nakalagay doon, if you may question about if you have received another vaccination within 14 days. Napansin mo ba yung...
Yes, Doc. Doc, that is the old that's the original checklist. Yung talaga pong nung original, yun po yung 14 days, no other vaccine 14 days before or after.
Yeah.
So, hindi pa po nila nabago yung checklist. Doc.
Agree, pero meron ng mga, meron ng mga interim na napalta na yan, na talagang meron niyang ganyang idea na hindi naman kailangan strictly na 14 days or yung ng bawat brand. Medyo loose yung interval ng mga vaccinations ng second dose. Thank you.
Okay, thank you. Jade, another related question for lactating mothers. Best time to get vaccinated against COVID virus? I'm not sure if it was answered na kanina. With regards to breastfeeding.
Lactating? Yeah, again, hindi siya naman major contraindication. Again, you have to weigh your risk. You have to weigh your risk. Kung kailangan mo na talaga ng COVID-19 vaccine and you're working in a very high-risk area, you may get vaccinated.
Okay. Eto, how would you push daw for a no jab, no work policy in the health workplace? Opinion mo lang. Tingin mo ba? Parang no job, no entry.
Opinion ko lang, hindi ko po kayang mag-push. Kasi hindi kasi lahat, ang dami po kasing gustong magpabakuna, but they don't have a vaccine because it's not their fault. They don't have a vaccine kasi hindi pa sila natatawag, wala silang schedule, but they really want to get vaccinated. So if we will have a no jab, no job policy, it's not their fault naman why they don't have a job. If our vaccination rollout will be faster at talagang kasalanan mo na kung wala ka pang bakuna, then maybe we can push for that. Pero ngayon, ang dami pong gustong magpa-vaccine pero hindi pa mabakunahan So hindi pa po siya fit sa
okay, from Dr. Heron o Franco Heron, antiplatelets should not be put on hold prior to vaccination.
Thank you, Dr. Franco.
Okay. So question is there a study on the effect of different vaccine based on ethnicity, like Asian versus Caucasians?
I don't think ganito po. This is the way I interpret the data. We can get that in terms of looking into the trial sites. Kasi may mga sites yan eh, like sa US or sa Brazil or sa Turkey or sa Indonesia. So subtly, you will have an idea on the effect. Pero wala pa pong, hindi kasi, hindi designed yung mga phase 3 trials to measure the effect of ethnicity. Not at this point. But we can somehow get an idea if we look into the trial sites of these phase 3 trials.
Okay. Pwede po kaya kahit anong vaccine sa individual na may cardiomeg, arthritis at varicose veins?
Yes, I would vote for a yes on that.
Okay, is it true that headache and runny nose are the most common symptoms linked to the Delta variant?
Oh, actually, totoo po yan, but hindi naman silang dalawa lang. Ang common po kasi, the rationale that is given for that is rather than having difficulty breathing and cough, usually mga mild symptoms po yung sa Delta. Kasi with the data na meron tayo, na nagre-report tungkol sa mga Delta infections, most of the infected individuals are young, those who are not yet vaccinated. So because they are young, they are immunocompetent, so they have less severe infections. So this is not because of the Delta variant per se, but marami pong factors kaya yun yung mga symptoms nila. Because the role of vaccination came into play. So halimbawa, nagka-Delta ka, tapos vaccinated ka rin naman, milder din yung symptom. So yun.
Kasi di ba may na-mention na parang with Delta variant, walang anosmia, di ba? Walang, parang yung symptoms with the previous variants, parang hindi lahat nandun sa Delta variant.
Yes. I think, ano ba to? New York Times yata. Hindi ko maalala doon pero yun yata yung article na yun.
Okay, can a patient under treatment for PTB can receive COVID vaccine, and can you consider it as a comorbidity?
Yes, you can. I think you should. And it may be a comorbidity. Yes, it's a chronic infection, so I will consider it as a comorbidity.
Okay, ito daw, from a nurse. What is the best way to clean our laundry from work, like uniforms and bunny suits? Do we need to add more than just basic anti-bac detergent?
Okay. Usual detergent, tapos there's also better data on warm water. 55 degrees and up na warm water. Tapos syempre, chlorine. Siguro hindi mo na kailangan ng warm water kung may chlorine naman. Color safe para walang
Okay. If a fully vaccinated individual had an antibody assay after 4 to 12 weeks from the second dose and the assay showed failure to develop antibodies, is it recommended to have another series of vaccine? If yes, will it be 2 doses?
Oh, ito na po yung sinasabi natin na there is no recommendation for it already. Yet pala. There is no recommendation for it yet. And because, kaya po hindi rin recommended na mag-test ka for antibodies after, no? So, but I would understand kung sa akin nangyari yon, gusto ko magpabakuna ulit, di ba? Yun yung isipin mo. This is beyond, this should be, sa akin po this should be taken on a case-to-case basis. The infectious, or hindi naman, no? Specialists should be asked regarding their opinion on it. Hindi po ito parte ng guideline kasi these are special cases. So, kung sa tingin ko, ako naman po, if you will ask me, for example, kung sa tingin ko na ikaw ay high risk, na ikaw ay nurse sa isang COVID ward at hindi ka nag-mount ng vaccine, I would probably recommend another bout of immunization for you if the vaccine is available. But if it's not, then I will just reassure you that you have other defenses aside from antibodies. Ang hirap po kasi we have vaccine inequity. I know, I understand. Many of us would want booster. Ayan na, ang dami, binibenta na. But ang hirap po kasi magsalita because a lot of us are not vaccinated yet. And to think na madodoblehan ka na at yung kapitbahay mo, hindi pa nababakunahan ng isa, parang medyo mahirap siyang ano. Their protection is my protection too. So I want to get them protected. Parang ganun.
Bago daw magtiga-tigalawa, magtigi-tigisa muna. Okay. Okay. The question, Jade, is nucleic acid testing a better indicator for COVID immunity?
Oh, what do you mean nucleic acid testing? Baka hindi ko po, you might know something I don't. Nucleic acid testing? I'm not sure if I get the answer. You probably know something I don't, Doc or Sir.
Oh,
Ano kayo sabihin nun?
Hindi ko rin sure kung anong niya sabihin ng nucleic acid testing. Anyway, moving forward.
Sorry.
You may unmute yourself, Ronilo Jader. If you want to clarify the nucleic acid testing. Okay, so sige. Anyway, ask lang po if the patient was diagnosed to have autoimmune disorder. You might want to expound on this. And taking immunosuppressants, pwede po kaya siya magpa-COVID vaccine?
Yes! Yes, definitely. Definitely. Kung ako po ang doktor niya, so ito po ang linya ko. Kunwari meron siyang autoimmune disorder, kunwari may lupus siya. Sige, dapat. Kasi if you get COVID, you are at higher risk to get severe infection or severe to critical infection because of your immunocompromised state. Yun nga lang, yung data natin with the present vaccines, wala pa siyang masyadong data on safety and efficacy of blank vaccine. So, hindi kita masasabihan ng percentage. There is a risk that the 94% efficacy might be a little lower with you, but that is still a higher percentage compared to not getting the vaccine at all. So, go ahead and get the vaccine.
Okay. We have a comment from Dr. Baryon, actually our CHO. It's the availability of the vaccines which is the problem nga naman. We only
Yes.
wait, diba? What is being delivered to the use. So, parang we are at the mercy of the national for
yes. Kasi kita mo, trabaho na di ba? Even Sundays, umuulan, nagbabakuna na yung mga tao eh.
Yes,
pero
pag walang bagyo di ba? I saw some posted mga pictures nila na nag-vaccinate.
Pero pag walang dumating na bakuna, wala talaga, kahit nandyan yung mga vaccinators. Yes, I understand with Dr. Rose.
Thank you, Dr. Baryon, for that. Symptoms-wise, ano pong difference ng Delta variant sa Alpha and others?
Symptoms-wise?
Oo.
Actually, not much difference po. There are some reports nga, yung kagaya po kanina, milder symptoms, headache, colds, less of cough, less of shortness of breath, no? Pero ano lang po siya, parang mga reports lang po. Pero we've seen naman, ewan po, parang yung pag sinabi mo na hindi naman magkaka-severe kapag bakunado, pero ang dami namang severe na vaccinated. So we really can't put it in one basket. Iba-iba po talaga.
Okay, ito. Maganda to eh. Ibalik daw ang lockdown. Is it possible to lessen the Delta transmission? Of course, diba? So parang i-rephrase natin, baka kailangan mag-lockdown para maiwasan yung transmission. Definitely it will help, no? Kaya lang syempre maraming, again, multifactorial. The word lockdown actually connotes a lot of things. Eh. So it's going to be really a big
economics-wise.
Okay, ito na lang. Dr. As lang po, pag po ba recovered na nung June 30 tapos po nag-ubo at sipon ngayon, posible po ba na infected pa din siya ng COVID?
Okay. June 30, na-infect po siya, tapos na-recover po siya noon?
I think, oo.
Tapos nagsipon ngayon?
Recovered, tapos nag-ubo sipon.
That's a very tricky situation. You know why? Because the tendency is for you to get an RT-PCR. Di ba, Doc? But again, ito na, may entry point. this is when we can get the use of CT values. That's for sa susunod na kabanata, yung lecture na yan, Doc. Alam ko nakakommit ako sa lecture na yung CT values, no? Pero right now, in terms of, in theory, no, once you get an infection, a viral infection, the likelihood of getting another infection of the same virus, whatever the variant, in the next 3 months is very, very low. So, the likelihood na COVID po ulit yon is very, very low. Yun nga lang, very, very low is not 0%. So, kailangan pa rin pong mag-ingat, kailangan pa rin pong mag-test. Example, if kunwari na-declare ka ng recovery ng June 30, now it's July 28, you get symptoms na nag-ubo, sipon, even if mild, ipapa-RT-PCR ko po siya.
Yes.
Kung mababa yung CT values niya, nasa mga 20s, papa-genome sequence ko yan. Kasi I wouldn't know, maybe you're the first patient to learn from.
Okay. Ito, related question ni Dr. Alba. How do we use the CT value in RT-PCR? Siguro kahit overview lang kasi you're planning to have a lecture on this.
Yeah, Dr. Cycle threshold values, principle, the higher it is, it can be a marker, although not absolute, but it can be a marker of lower viral load. The higher it is, it means that the specimen has to undergo more amplifications for it to be able to detect viral genetic material. So, in essence, we want a higher CT value over a lower CT value. Okay. Abangan ang susunod na kabanata.
Ito question ni Dr. Nilo. Maraming pasyente dito may white coat hypertension. How would you comment about the deferment of BP measurement in evaluation prior to vaccination?
I'm a go for that. I'm a go for that, though. You know why? It takes time. It takes contact. It prevents immunization. So, yun yung ilan eh. Kung halimbawa magkaroon ng symptoms after, hindi saka ako magbi-BP. Ganon. That's just me. And I don't know, Philippine Hypertension Society, I think, or cardio. So ako po, I'm a go for that. Yung iba nga, di ba, Doc? Drive-thru, jab lang ng jab. Wala namang heat.
And they just stay for like mga 30 minutes, di ba? Sa drive-thru. Okay. I think that's, ito pa, last na. Advisable po ba gumamit ng UV light and how often?
For what?
Siguro?
I'm assuming for a room or for your things, right?
Oo.
Sa akin po, I personally use the UV light. How often? As long as you are not exposed to it, as often as you want. Basta hindi ka lang exposed and only your stuff are exposed to the UV light. But let me remind you, in terms of infection control, the UV light is not a replacement for cleaning. Okay? So you still have to clean. Soap and water or sometimes yung disinfectant, i-clean mo yun. Kasi, tsaka, yung simpleng soap and water lang. Kasi that will remove the organic matter on the surface that you want to sterilize. Minsan po kasi mayroong mga certain disinfectants na hindi gumagana pag may organic matter. So, again, nothing beats soap and water pa rin. Tapos saka mo siya i-UV. Pero syempre, kung cellphone naman, hindi naman pwedeng soap and water. So, ginagawa ko, alcohol, tapos pwedeng i-UV ko rin siya. Yeah, that's my answer.
Okay, so do we have any other remaining questions from the audience? We still have, 520 audience pa na present. Yes. Parang postgrad si Jade.
Opo.
Do we have any more?
Nag po yung postgrad natin.
Oo.
Salamat
kaya nga, Dr. Florence, they were asking kanina when to stop. I said, do not stop because this is the most practical or most timely time to answer, to ask, and Dr. Jade can answer the question. Thank you very much, Dr. Jade, for a well-discussed topic and a well-answered questions.
Yes. May last question, Dr. May last question, Jade. Ako nasasagot. Nakalagay kay Dr. Puntalan. Are you taken daw?
Oh, hindi pa, Doc.
Okay, so if there are no more questions, we would like to thank everyone who participated in the question answer.
Doctora, can we have a photo op session first before everyone goes out?
Sige po.
Salamat po sa inyo lahat. Thank you po.
Okay po. Pa-open po ng mga camera.
Thank you, Dr. Jade.
Thank you, Dr. Jade.
Paki-open po lahat ng videos.
Thank you, Baliones.
So that we can document this very special lecture. Kindly open.
Okay, thank you everyone, Dr. Jade and Dr. Santos for that very detailed and informative discussion. May I call now on Dr. Lorelai Perez Miranda for the closing remarks.
Nakalimutan na.
Okay, hello, good evening. Okay, magpi-picture taking ba muna? Okay.
Picture taking muna.
Okay.
And also the certificate, Doktora
Kasi
Jade.
Doktora, nag-aalisa na yung tao. Kaya pwede rin siguro while taking the
Picture taking muna po tayo.
Please open your
Hindi ko po
camera.
maiisabay yung ano. Okay po, first slide po.
First slide.
Okay po, 1, 2, 3. Next slide po. 1, 2, 3. Next slide po. Medyo madami pong slide. 1, 2, 3.
Walang tama ang inyong mukha.
Fourth slide. 1, 2, 3. Next slide po. 1, 2, 3. Next. 1, 2, 3. Next po. Hindi na po naka-open yung pang-pitong slide. Sige po. 8, 9, 10,
Ilan ba yun, Elva?
11 slide na po ako. 12,
Nakakapagod ngumiti.
13, 14,
Ilan ba?
15, 16.
Cellphone yata si...
Last slide. No, doktora, naka-laptop ako. 17 slides po kayo for 113.
Oo, madami nang nakaalis.
Wow, galing!
670 plus po tayo kanina.
Okay.
Certificate po, I will share.
Elva.
Naka-share na po, nakikita po ang
I
ano.
cannot read, Elva. It's so small.
Wait po. Okay na po.
Okay, we would like to 2021.
Hello?